The return on investment in adolescent health is estimated at between 5 and 10 US dollars spent, with school-based and community-targeted interventions being highly effective. In Kenya, therefore, we are deploying community health promoters to bring vital health information and services directly to communities as part of our commitment to a sustainable and equitable future by securing the health and well-being of all women, children, and adolescents. We have had a robust conversation in Kenya. We had 2 programs that were running. One, Linda Mama, that was an insurance program to make sure that every mother who is going to give birth, the government of Kenya pays for the prenatal and postnatal services. We have since, under our new universal healthcare program, expanded that to include the child up to 5 years, so that we can take care of that moment in time when children are most vulnerable, between ages 0 and 5. We have also expanded what initially we called Edu Afya, or Education Afya, where we had an insurance program for all our secondary school children. Under our new program, we have expanded that to include every child from primary school to age 18, so that every adolescent has a government paid-for insurance program to take care of their health needs. Although Kenya has made considerable progress in reducing maternal and under-5 mortality, challenges such as inadequate funding and limited capacity to provide essential services persist. We recognize that only a multi-sectoral approach, including healthcare, education, and community support, can accelerate mortality reduction. Towards this end, it is therefore essential to increase investment, enhance collaboration, and focus on primary healthcare to scale up key interventions like skilled birth attendants, vaccinations, and improved nutrition. Recognizing that only urgent collective action can save millions of lives by 2030, we have pledged to enhance partnerships and establish a dedicated fund for maternal and child health. This fund will help advance progress towards SDGs by improving service delivery and expanding access to essential care. From an economic perspective, keeping people healthy is immensely beneficial. Studies show that every dollar invested in maternal and child health yields $9 in returns through improved health and productivity. Any annual investment of 1.5 billion US dollars could save 35 million lives by 2030 and generate 100 billion in productivity and healthcare savings. We have a singular opportunity to escalate our contributions to global health initiatives and significantly enhance their impact by supporting Africa Health Strategy and KAMA campaign, that's campaign on accelerated reduction of maternal, newborn, and child mortality in Africa, as an ideal starting point.
The Global Leaders Network is called upon to protect the rights of vulnerable populations and present evidence that demonstrates a reduction in morbidity as well as in mortality. We therefore issue a call to action. We call on heads of states and government to seriously take women and children and adolescent health up in everything they do and join the Global Leaders Network. We also call on countries, as well as on donors and commercial and developmental investors, to carve out a specific funding agenda for women, children, and adolescent health. And we do, yes, also make a call on countries across the world to collaborate and to work together and cooperate to meet the financing targets for organizations that support women, children, and adolescents' health. These include the Global Financing Facility, UNICEF, and UNFPA. We call on stakeholders in the women, children, and adolescent health sector to target those countries with the highest maternal, neonatal, and adolescent mortality rates. And there are quite a number of these. And we also call on academics and civil society to continue to provide evidence and compelling arguments so that urgent political attention and action can be taken, including investment in the health that affects women, children, and adolescents. And we call for equity in manufacturing, in access to sexual and reproductive health products, and in quality health services for women, children, and adolescents.
Your Excellencies, last year, you rightly noted that if we secure the health of child and women, we will improve the health of all humanity. Yet, we are far from achieving the Sustainable Development Goal of reducing maternal deaths for 70%, 100,000 by 2030. Alarmingly, about 800 women die daily from preventable causes related to pregnancy and childbirth around the world. This situation compels us to act decisively and prioritize a better future for every child. Excellencies and dear delegates, this meeting is important to agree on actionable steps to accelerate progress in women, children, and adolescents' health. Effective leadership is essential to strengthen health sectors and expand access to primary care. Long-term sustainable funding is critical. Every dollar or cents invested in health yields substantial societal dividend. Additionally, sharing best practice and focusing on data analysis will enhance our collective efforts.